Welcome to rePROs Fight Back, a podcast on all things repro. I'm your host, Jenny Wetter, and each episode I will be taking you to the front lines of the escalating fight over our sexual and reproductive health and rights at home and abroad. Each episode, I will be speaking with leaders who are fighting to protect our reproductive health and rights, to ensure that no one's reproductive health depends on where they live. It's time for rePROs to fight back. Hi, everybody, and welcome to this bonus episode of rePROs Fight Back. We are again recording from Women Deliver, and unfortunately it's gotten a little loud in the background here, so you're all going to have to bear with us for this important conversation. So with me now, I have Estrella Alcalde with Pathfinder International, and she is currently in Mozambique. Hi, Estrella.
Hi, good morning, Jenny. Thank you.
Thanks for being here. Do you want to tell me a little bit about your work?
Okay, I work for Pathfinder, as you said, in Mozambique, and I actually involved in several projects working to promote sexual and reproductive health, particularly with adolescents and youth, also promoting gender equality. And actually, I see that as something that goes together. Like, we cannot talk about gender equality and women's rights, girls' rights, if we are not tackling sexual and reproductive health and rights. And we cannot talk about sexual and reproductive health and rights if we are not also addressing gender inequalities. So it's something that really goes together, and we are working on this in several projects. And maybe I could talk a little bit about one of the projects. That is a project actually funded by Global Affairs Canada, and that I have been talking about in this Women Deliver conference.
Okay, so you want to tell me a little bit more about some of the projects you're working on in Mozambique?
Okay, I will actually focus on one specific project. It's a project funded by Global Affairs Canada in two provinces where we have high rates of early marriage, high rates of early pregnancies, also where gender inequalities are very strong and present. And so in this project we are focusing on adolescent girls and young women to improve gender equality, and so that, as we say, that these adolescent girls and young women can exercise their rights to bodily integrity and their rights to sexual and reproductive health. And this is something that goes really together. And we, as one of the first steps in this project, was to carry out a survey. We carried out a survey with the girls and women and young women, and also with men in the communities, to really have a better knowledge of what were the social and gender norms in the communities, what were the perceptions and attitudes towards certain issues of gender relationships, how were relationships in the house, how they saw that, and also in relation to contraceptive methods, to gender-based violence, and so it was a survey that has given us a lot of information on what is the context we are working with.
Great. Was there anything that surprised you in the survey?
Well, actually, there is some information that really is aligned with the demographic and health survey that was carried out all across the country. It's like some statistics are similar, but we did, for example, find out that the gender marriage is more common than what we thought it was, based on those statistics. Something that, we know when we work in this field, but I think that the studies shows is that also women themselves and these young women, they also have very ingrained patriarchal norms.
Yes.
And so how, for example, when they were asked, do you think that a man has the final say in the household? I mean, we had even more girls and young women saying that yes, it is the man who has the final say in the household than the men themselves. Or when they were asked if a man has the right to kick his wife out of the house if she's raped, they also said, many of them, almost more than a quarter, said yes, he has that right. So I think that is some aspect that we have to remember that themselves they also believe that, and or that there are situations in which wives deserve to be beaten. No? Half of girls think that there are situations, for example, if she's cooking and she burns the cook, or if she didn't take good care of the children, or she left the house, or she in different situations that she did wrongly. So I think this shows how these women also accept. In that context, these situations are accepted and normalized, and that's why at the community level they are seen. If a woman is suffering domestic violence, it's sometimes even thought of, okay, the man is even educating the woman, right? Or is his role to do that, and so we are not gonna get into that situation, and it's accepted, and even if it gets really bad, the family kind of. The family also kind of is there to conciliate. But
I feel like that's one of those things that is not particularly uncommon to see, is the difference between the ingrained gender norms that maybe aren't actually held. I know in a lot of countries you see, like with family planning, you see a lot of girls and women saying that men should get the final say, or he's against it. And when you see the men being asked, they're in favor of it. And it's just this very different views.
And then something also, the fact of the pressure that these girls have to show, first to get married and also to show their fertility.
Yes.
No? Because it's in their fertility that they are valued. And the survey also showed that 1 in 4 men think that a woman who cannot bear children is not a real woman. And the girls responded the same way, no? And so it is something that, so the pressure that they have to show that is very, very strong. And so this is something that also the studies showed and that we are working about. And then the barriers that girls and young women have to, for example, access family contraception, or they're also very, very, very important, and that also includes, different barriers. One of them, for example, health providers bias.
Oh yeah, absolutely. That is something you run into in a number of ways, right? Whether it's not wanting to give it to unmarried women or girls who haven't already had a baby. Sometimes there's that, or just even younger people going, they don't want to provide services or aren't going to provide them in a youth-friendly way. There's a lot of biases.
A lot of judgment and a lot of, or not providing all the information available, or even the health provider taking decisions for the girl or the young woman herself. No, it's like already saying what you should say, what's right for you, and not letting the girl or young woman decide for herself based on the information, wide information. And so this is something that we saw in the survey, but we are also seeing in our activities in the field.
One of the things you saw in the survey is girls internalizing a lot of the patriarchy and accepting that gender-based violence is part of their lot in life. Is that something you're also feel like you see a lot in the clinics and stuff as well?
We see that in we see that in the field, and also that is linked to even, for example, when it comes to sexual violence, the way we see that there are many adolescents and young women being sexually abused, assaulted, raped, and the way they take this is usually in the guilty way. They feel that they probably, or as the culture says, you were provoking, or you were, so usually there is a lot of first guiltiness and then shame. They also feel like being not pure, not being again valuable, no? Mm-hmm. Like that. And so and when it comes to in the domestic area, in the household, many times they feel it like, well, this is the way. My mother also said you have to to face this. It's always been like that. Sometimes it's like that. You have to endure this situation.
Right.
And I mean, but at the same time, we see that there are also more girls, young women, speaking out, reporting cases. I mean, this goes also together with active actions that are being put in place to have a response to gender-based violence. So there is, particularly as Pathfinder, we are also working with the health providers. We are working with the police. We are addressing gender-based violence in a multi-sectorial way and involving different partners, so that there is a more broadened response to gender-based violence. So I think that's also starting to make more girls and young women to report, to have services. I mean, for example, one of the interventions that we have with the health system is to have make a response. That means to have prophylaxis, to have emergency contraception, to have trained providers to attend these cases in a friendly way, and because we also had situations in which it was also the provider who would be judgmental to these cases.
Yeah. That's always heartbreaking when you're already traumatized and then aren't getting compassionate care when you see a provider. So it's so great that you guys are working to ensure that changes at your in Mozambique. So what are some of the strategies you guys have been working on to change these gender norms that we've been talking about?
Well, we're working at the individual level. In that sense, we are working with mostly with girls, but also we are working with boys. But with girls, is particularly creating spaces for girls to discuss issues related to their body, to their rights, health issues. Even just having their spaces to share their ideas. Sometimes that doesn't
really
exist.
Important.
Yeah. Also, we are working with starting also from a younger age. We are working with primary schools in 5th and 7th grade, with boys and girls also to start talking about taking decisions, thinking about at that age of changes, of puberty, and also what those changes mean. Talk about menstruation, for example, which is also a big taboo and a suffering for many girls. And what that means. And so it's, we starting to talk about violence and what is right and is not right. We start working around these issues in primary schools, then in secondary schools, and then also we have these groups of girls outside the school, because we also know that there are girls that or they left the school earlier, or they are married already,
right,
or because they got pregnant and then they didn't go back to school. So there are also many girls that are outside the educational system, and that we are also working with them. And we also have a community intervention, because we know that if we want to change the gender norms, and if we want a more enabling environment for adolescents and young women and boys to also have access to the health, sexual reproductive health services, the community should also be involved. It has to be supportive. Yeah. So we are working with community leaders. Actually, we have community leaders that are part of the project. They are involved in the project and they are allies, and who they also had to go through training, and also they are still in a process of also reflecting and learning themselves, and kind of, so it's but they are already, let's say, on our side. And we also work with other community activists that they are creating spaces within the communities to discuss around these issues. So we have different types of activities, community debates, groups where we have men and women together having open discussions and dialogues. We are also working with men. Some of them, what we say, the barrier men or the difficult men. Not all. It's not just groups of the difficult ones, but some of them are those parents that they want their daughters to leave school, or men that we know that they are a bit aggressive, or that we have some specific, and with other men in general, we have specific also groups to discuss these issues and to work on a bit on masculinity norms. And then we have another type of intervention, which is more clinical interventions, and also working with other institutional partners, like I was saying, health system, as well as social action institution and others.
Yeah, it's really important. Like, we often talk about needing to work with the young girls and boys, but also working with the broader community, because, you know, if we talk about the importance of the girls are newly empowered or feeling like they want to stay in school and don't want to get married, if you're not also working with the community to change the community norms, it's harder for them to do that. Or if girls decide they want to access services, but the rest of the community hasn't been brought along, they might not feel comfortable going to the clinics to do that. So it all needs to happen.
If that girl has an aunt who is supportive, right, that maybe she could go with her to the health facility, or if she knows that her mother or her sister, older sister, is someone she could turn to if she has a problem, because I think that's essential. And actually, sometimes there are some projects where it seems that they focus more on just on the men, like as a barrier, but we know that we should, of course, also work with those mothers, those grandmothers, the aunt, in the end, everyone in the community who is also supporting certain norms that
absolutely. And sometimes the mothers are more the gatekeepers than the men. We've seen that with some traditional practices, like with FGM, that often it's the mothers that are still very invested in keeping the practice alive and not the men.
Absolutely. Yeah. So those are, I would say that these community dialogues are very, very interesting, because they really get to have a reflection, and they bring for example, on some practices, like could be early marriage, or what are the effects of this? What happens? Is it good? Is it not good? Why? What if this girl doesn't marry at 15 and she marries at 20? What are the different? They put themselves in different situations, and so just to at least to start questioning if this is good or not, or what are the effects, I think it's already a great step forward. At least to start thinking about it and reflecting together about that. I think that is the first step for change.
Absolutely. So what can listeners do to help change social norms, not just in Mozambique, but, in their own community?
Yeah. Well, I think we all can do something. We should start from ourselves.
Right.
And I think, for example, just on how those who have children, I think we should realize and think more about how we are educating them. Are we educating them equally? Are we also already reinforcing stereotypes since they are born? Or so I think from in very simple things, actually, and how we manage our households, and are we sharing tasks with our partner? How decisions are made in our house. So I would say at all levels, breaking the silence when we see inequalities, when we see also violence, but sometimes it's this micro-violence that
absolutely
we don't consider. It's not just talking about rape. There are so many forms of violence that sometimes we are not, that somehow we are overlooking, and in small things. Something that I particularly like is language, how we use our language, and how language is also...
Yeah, language matters.
Language matters so much. And the words we use, how we use them, I think we should start being more careful about.
Absolutely. That's something I've been working on, and I think everybody needs to be paying particular attention to the words they use. And it can go a long ways to making a difference, particularly for marginalized people.
Yeah, absolutely. And I think we realize that we can be we are not inclusive many times.
Yes.
In our language. And that we leave many people out. Yeah.
Absolutely.
Or invisible.
Yes. So that is our homework this week, is everybody needs to sit down and think about their language. And I know I'm trying to be better, but I'm not always going to be perfect. But I also encourage listeners to push me if they catch me not being perfect, to do better. And, maybe there are things that you haven't considered yet that are ways you can be better. And so I always encourage people to push me to be better. So, Estrella, thank you for being here. It was a wonderful conversation.
Thank you.
For more information, including show notes from this episode and previous episodes, please visit our website at reprosfightback.com. You can also find us on Facebook and Twitter at reprosfightback. If you like our show, please help others find it by sharing it with your friends and subscribing, rating, and reviewing us on iTunes. Thanks for listening.